Okay, let's begin. Good morning, everyone. Welcome to our webinar about health risk assessment principles and method of IFSA and EPA. My name is Tingting Guo. I'm responsible for pesticide registration work in CNCIC. This webinar event is organized by CNCIC and Smart Docs and LISA. Before we start, I would like to introduce today's agenda. The first part, I would introduce the webinar background and CNCIC. The second part is introduction about Smart Talks and Lisa and also our speaker. They are all our collaboration parties. The third part is just the presentation. And the last part is the Q&A section. So let's begin with the first part. The webinar today is a general introduction about health risk assessment of IFSA and EPA. As we all know, after new act published, health risk assessment is a quite important dossier for pesticide registration submission. Corporate risk model is easy to learn and use, but if we get high risk results, we could hardly find a way to optimize the result or given some risk control measures. So sometimes we just refer to EPA unit exposure and IFSA models to try to figure out. But most Chinese companies still lack of comprehensive understanding about IFSA and EPA health risk assessment. So today we just invite experts from SmartDocs and LISA to give us a lecture about it. We would arrange a series of special topic webinars about IFSA and EPA health risk assessment in this year. You could pay close attention about our webinar advertisement about the following webinars. Let me introduce CNCIC first. CNCIC is a well-known chemical consulting research and information service provider with more than 60 years history. CNCIC is mainly engaged in chemical industry consulting, HSE, information technology, competitive intelligence, convention and exhibition and publishing business. And we are in compliance department. Compliance department in CNCIC is responsible for pesticide, fertilizer, new chemical, registration work, and also cosmetics and disinfectant record work. Pesticide registration team in CNCIC have many years of experience on both overseas companies and local companies registration work. We have customers all over the world. We have rich experience on new AI pesticide registration and also generic products registration. So we are quite strong in this field. Most audience are our clients or our best friends in this field, so I need not to say too much about ourselves. And I would also introduce Smart Docs and LISA in this part. The boss of Smart Talks company is Mr. Alexander also planned to hold this meeting together with me, but he has some emergency today and could not come. He just stay in hospital. So I just introduced them instead of him. SmartTalks is a born global company as it was born operating in the international market. Sorry. It has national and international partners with over 30 years of experience in the agrochemical market and vast expertise in regulatory toxicity and applied chemistry. They are specialists in risk assessment, evaluation, and QSA analysis for Europe, Brazil, Mexico, Australia, and USA. Lism provides software support work for GHS and SDS fields. It works closely with industry verticals to offer tailored and specialized solutions for EHS compliance. Our involvement in and relationship with leading industry associations worldwide has enabled us to understand, innovate, and develop customized integrated models to solve the daily compliance challenge of various industries. Lism's software solutions and content enabled efficient and effective management of materials information relating to regulatory compliance, hazard communication, environmental reporting, and inventory management throughout every phase of our product life cycle. Our lecturer today is Mrs. Fatima. Dr. Maria de Fatima Meneses Pedroso. Sorry, that is my pronunciation is not quite good. We just call her Fatima, Mrs. Fatima. She graduated from in pharmacy and biochemistry field. She's a master in toxicology analysis and got PhD in public health. So, okay, let's move on to the next part, which is the most important part in today's webinar. Fatima,
yes.
I just change you to be the speaker. You can share your screen to everybody.
Yes.
Okay, we could see your screen now.
Okay, then. First of all, ni hao. And I thank everybody for listening to our presentation. I'm going to talk about human health risk assessment. We're talking about today, we're giving an overview about dietary and non-dietary risk assessment. So, wait, I just cannot do that. I just pressed the wrong button. No? I can change my slides. I don't know what happened. Oh, here. Now, what is risk assessment? In a metaphorical sense, risk assessment is the integrating bridge between
Sorry, Fatima, we could not see your screen.
Really?
Yes.
Just a minute. Let's do it again. Oh, can you? Oh, okay.
Okay, we could see
now,
it
can
now.
you see it then?
Yes, I could see it.
Okay. Is that all right? Can you see the word bridge?
Yes, I see the bridge.
Okay, it's okay. Then what is risk assessment? In a metaphorical sense, we can say risk assessment is the integrating bridge between data, that may exist regarding the hazard toxicity and an understanding of the hazard and its potential to cause harm. Can also define risk assessment, just it's EPA's definition, as a qualitative and quantitative evaluation of the risk posed to human health or the environment by the actual or potential presence and or use of a specific chemical. So we have to correlate hazard to risk and toxicity to risk. What is hazard? Hazard is the potential of a chemical to cause some type of harm. Toxicity is a type of hazard. So what is risk? Risk is the probability of harm or adverse effect caused by a chemical under exposure conditions. So we can say risk is hazard is equal hazard times exposure. If there is no hazard or stressor, there is no risk. If there is no exposure to the chemical, there is no risk. And what do we have to consider under exposure conditions? Physical chemical properties, dose or concentration, routes of exposure, duration and frequency of exposure, and susceptibility, inter-species variation. So we have in this tool, in the risk assessment tool, we have 4 steps: hazard identification, dose response assessment, exposure assessment, and risk characterization. And this tool is used for risk management. The first 2 steps of risk assessment, hazard identification, and dose response assessment are part of the toxicity assessment. So the first step, hazard identification, answers the question, what kind of toxic effects does this chemical do? How does it do it? Hazard identification uses in silico and in vitro data, mainly for local and acute effect, and uses animal data for chronic effects, mostly to predict human adverse effects. And if it's available, epidemiology studies can also be used. So, hazard identification steps has to consider toxicology data from all life stages, from conception to senescence and death, to fully obtain toxicity information about a chemical. And what is very important is that in this step, in hazard identification, which is we do a qualitative description, it's based on the type and the quality of the data. So we have to weigh the evidence. The data quality is very important. And types of data, human data brings stronger evidence than animal data. In vivo data has a stronger evidence, a stronger weight of evidence than in vitro or structure activity relationship. And both negative and positive data have to be consider. This is very, very important. The second step is dose response assessment. Dose response assessment is a quantitative step, and is the relationship between the magnitude of the dose and the specific biological response. Response can be expressed in different ways, but usually we use the percentage of response in a group of subjects or population. Here is an example of those response curve showing the fraction of people or the fraction of population who are likely to exhibit a given effect at varying dose. It's a log curve, log normal curve. And this, we can have all shapes, different shapes of those responses curves, but from animal studies, we always will have this log curve. Animal studies, we use 3 experimental dose groups and a control group, which is equal to the experimental group, except for the exposure to the tested substance. And those are, the blue dots are the experimental doses. So if we are lucky, we will find at the end of our study, we'll be able to identify a no observed adverse effect level. And what is no AL? Is the highest experimental dose with no observed adverse effects. And this will be our point of departure. From this point of departure, we'll extrapolate from high doses. All animal studies, in all animal studies, we use high doses. And why do we do it? Because we want to see what kind of toxic effect does the chemical do. And in order to see it, we have to use high doses, because we don't, in the beginning, when we are first testing the substance and we don't know anything about its toxicity, we can make sure at the end of the study, we will see the toxic effect. So we have to extrapolate from high doses to low doses and from animal to human. How do we do it? We have a lot of possibilities. How we do it now, right now. So first of all, we start selecting our point of departure. And the point of departure is the lowest dose, experimental dose, that is supported by data. But we have to consider the high dose to low dose and at least the interspecies difference and interspecies difference. I mean, from animal to general population and from human to human sensitive. So we are going to start dividing our reference dose, our safe dose will be the point of departure, no AL in this study, divided by the uncertainty factors. And when we just multiply the uncertainty factors. So in this webinar, we are going to talk about human health risk assessment, focusing on dietary exposure and non-dietary exposure. Non-dietary exposures includes operators, agricultural workers, residents, and bystanders. And how do we calculate these regulatory reference doses for those two scenarios, dietary scenario and non-dietary scenario? In the dietary scenario, we estimate, we calculate the acceptable daily intake, which is the threshold for lifespan exposure. We can have an acute reference dose also, but right now, since we don't have too much time to talk about it, we are just looking to the chronic scenario exposure. And in the non-dietary scenario, we have an intermittent exposure, and we will have the acute acceptable operator exposure level and the acceptable operator exposure level, which is the subchronic exposure. Those reference doses are adopted by EFSA model, European Food and Safety Authority. They were proposed by those experts. And they are used to operators, agricultural workers, residents that live just nearby the crop, and bystanders that are just passing by this crop. The American EPA uses the point of departure NOAA and establish a level of concern. It's a little bit different. I will emphasize the reference dose ADI and acceptable operator exposure level because I've learned it's the way China is doing non-dietary risk assessment. So the acceptable daily intake, which is a reference dose, we calculate dividing the NOAA by the uncertainty factors. And if we use animal studies, at least our uncertainty factors is 100. 10 interspecies difference times 10 intra-species difference. We have others uncertainties that have to be considered depending on quality, reliability, and completeness of toxicology data. For instance, if my study that follows GLP practices and it's well done study, has high quality data, a reliable data, but unluckily, the 3 experimental doses, they promote an adverse effect. So I don't have a no AL, I will have a low AL, which is what? The lowest dose that promotes adverse effect. If I'm using low AL as my point of departure instead of no AL, I can multiply another 10 in my uncertainty factors. For example, an example for abamectin, which is an insecticide. AFSA has selected the point of departure from developmental neurotoxicity studies in REC, which is 0.12, and divided by 10 interspecies times 10 intra-species difference. So we will get the ADI calculated by this agency is 0.001 milligrams per kilo a systemic AOL, just like this example. SIDA, the point of departure is an oral NOAL obtained from a short-term study, 9-day RECT, equals to 1 milligram per kilo per day, divided by 100, 10 times 10, inter and intra-species difference, times 30%, which is the oral absorption factor for this pesticide day, and the AOL is 0.003 milligrams of active ingredient by kilogram of body weight per day. So it's important because we have to know this absorption factor. So what do? We hazard identification. I will get all the toxicity studies information of abamectin. And then I will calculate it reference doses. What can we see here? Different countries or organizations can select different point of departures and consider different uncertainty factors. So we will not have the same, just one reference dose for the same substance. It's scientific judgment that the risk assessor might have. It's important, and the risk assessor has to explain it's quantified as the amount of a chemical available at the exchange boundaries of the organism. And in the exposure Assessment answers the question, how much of a substance is an individual or a population exposed to? Contact is required for exposure, and without exposure, there is no dose of exposure. So we have to consider exposure source, exposure pathway, exposure medium, and exposure route in order to calculate exposure dose. Exposure dose answers the question, how much chemical has the individual been exposed to? And its function of concentration of the chemical in exposure medium and the duration of exposure. So in dietary exposure assessment, what do? We estimate a pesticide dietary intake. So both long-term and short-term dietary exposure based on toxicological and residual chemical assessment and dietary consumption, national diet, dietary consumption of Chinese residents, because dietary habits are different from country to country. And the residue definition includes the active ingredient and its metabolite, degradation products which are of toxicological concern. All residue data, maximum residue limit, highest residue, this data arises from supervised field trials, which reflect application, dosage, duration, frequency, and interval of application, and pre-harvest interval. So we can calculate it in a chronic dietary assessment, the national estimated daily intake, NEDI. The NEDI is the summation of a medium concentration of pesticides residue in different kinds of food where this pesticide has been used, times FI, which is the consumption data, the average daily intake of each kind of a food that contains the pesticides and comes from report on monitoring the nutrition and health status of Chinese residents divided by the body weight, average body weight of the Chinese of different age groups. And non-dietary exposure assessment, it considers different exposed groups. Operators, which are responsible for pesticide application, mixing, loading, application, cleaning, repairing, emptying the bottles of pesticides. Workers, agricultural workers, they, as part of their job, they enter a treated area or handle a treated crop. Bystander are those just located within or nearby the treated area, or when application is in progress, so it's acute exposure. Residents, they just live, work, attend school or any other institution just next to a treated area. So it's a longer term exposure. And those exposed groups, they can be directed exposed to the pesticides, contact with the spray drift, dermal or inhalation routes, which happens to the operator, and indirect exposure, contact with drift deposits, dermal routes, vapor drift and rising from volatilization of deposits, inhalation. So we have agriculture workers and an inhalation resident exposed group pathway. So calculation, let's take an example for operator exposure levels. Calculation of operator exposure takes into account formulation, application methods and equipment, crop characteristics, environmental conditions, and other factors. So operator exposure is derived by using a unit of exposure level method, which is specific to a scenario. So we have the full unit exposure values, usually given or developed by authorities for different scenarios, irrespective of chemical identity. A scenario refers to specific type of application equipment, formulation type, job function, and level of personal protective equipment, PPE. We have the two largest databases of unit exposure value are PHAT, and the most recent data PHAT published, it's also added to the Agriculture Handler Exposure Task Force for values. Those are mathematical models based on measures from field studies. In the PHAT database, they use the central tendency values. And the other big database we have belongs to EFSA, which is European, and it is the unit of exposure values are the 75th percentile of a log normal distribution for a subchronic exposure. Okay, if it's acute exposure, it's the 95th percentile. This is the timetable, the reference table of PHAT, which has the exposure scenario, activity, equipment, formulations, exposure routes, the personal protective equipment level, and the unit exposure values. We have to pay attention because this reference does, the unit is microgram per pound, because Americans work with this kind of units, and it's the mean value. In the EFSA model, it's hard because we have the log normal prediction. So we have this EFSA calculator, and the input of those unit exposure values are under this timetable, this spreadsheet. Here we can input all the data, including the reference doses and the dermal absorption, oral absorption, and inhalation absorption percentage factors they can input, and the EFSA calculator will estimate the risk without any PPE and with PPE. But if we use this data, I mean, it's for European countries and for European agriculture practices. If we do not have any country field trials measurements, it's better than nothing. But it does not have all the scenarios. For example, the EFSA model does not have aircraft delivery as pesticide application method. So we are going to in Brazil, we had the HAFT unit exposure levels, and we have to convert the data from microgram per pound to milligram of active ingredient per kilo. Okay, I don't know if you have all data. I know which kind of data you have, but you will have to use EPA's unit exposure levels in these cases until China has its own field studies done for each type of application method. What I've learned is you have a crop risk, pesticide risk assessment model since 2018, but however, this model contains exposure data for backpack sprayer pesticides application only. So if other kind of application method has to be considered, you're going to have to use data from other databases. I've learned that from Food and Agriculture Organization, which has this pesticides registration toolkit, and they told that China is using AOL as reference dose, and what is crop risk models and risk assessment as a tiered approach, just like EFSA model. Also, I have to thank Mrs. Ting, who translated this guidance on health risk assessment, the key points of this guidance on health risk assessment of pesticides operators, because I don't read Chinese. Well, so for operators, what exposure doses do we calculate? Dermal daily exposure and inhalation daily exposure. Those are the equations, the formulas we use. Estimate, and then we add thermal exposure to inhalation exposure to have the total exposure, systemic exposure. After that, we can estimate risk. So the last step of risk assessment is risk characterization. For dietary scenario, what do? I'm always comparing the exposure dose to the reference dose. In the dietary scenario, I will divide the national estimated daily intake by the acceptable daily intake, reference dose. If it's lower than 1, the risk is acceptable. Otherwise, I will not, as the regulatory agency, I will not allow the use of these pesticides in the crop A, B, C, or D, for instance. For the protection of operator, worker, bystander, and resident, we compare the total exposure dose to the reference dose, to the acceptable operator exposure level. if the exposure dose is lower than the reference dose, the risk is acceptable. In EFSA, they calculated risk quotient, and I suppose you're going to do the same since the reference dose AOL will be calculated. So you are going to compare the total, the systemic exposure level to the AOL. If it's lower than 1 or lower than 100%, risk is acceptable. EPA does another estimate risk in a different way. They use the margin of exposure. So they get the point of departure, animal NOAL, and divided by estimate total exposure. If it's higher than 100, most of the time, the risk is acceptable. Why most of the time? Because the level of concern, which is 100 in this case, is equal to uncertainty factor. So it can be 300, 1,000, for instance. But let's give an example using AOL. So in this example with this herbicide, we have to know the application rate, treated area, which application equipment is used, it's tractor mounted, and the kind of, also select the kind of protection, personal protection equipment or respiratory equipment. It has to be used, and then we are calculating risk. It's the old calculator, EFSA calculator, I'm showing right here. So without any PPE, the risk, there is risk, it's exceeded a lot. With personal protective equipment, the risk is acceptable, but it's so close from 100. So if we, if the rate goes 10% higher, even with PPE, the risk is unacceptable. So we see the protection, the personal protection equipment, it mitigates the risk. Wearing gloves, for instance, can mitigate the risk. But if it's too close, we have to pay attention. Otherwise, in this case right here, some actions have to be taken to manage risk. For example, tractor-mounted application will be not allowed by regulatory agency for this pesticide. Okay, at least in this kind olive trees, in this kind of crop. So this is how we estimate risk as tool for risk management. I thank you for your attention, and I'm free to answer any question you have. Thank you very much.
Thank you, Fatima. Okay, let me check how many questions. Okay, let me share my screen. We have one question already. Okay, could you see my screen?
Yeah. How could we decide uncertainty factors when we use EPA exposure index sheet, but the application equipment and method are not the same? We cannot. I mean, the uncertainty, first of all, let's split the question. Uncertainty factors are used to calculate the safe dose, the reference dose. There is nothing to do with the exposure dose. Then, if it's not the same equipment, we cannot use the data because it's unreliable. If we pick a number, it's unreliable. It's not the same. Remember what I've said, that it's the unit of exposures unit. They are measured and they are trial field measures. So, and it's independent of the chemical. It's just the way we use, it depends on the application method, basically, and then all the factors that goes along with it. I mean, treated area, the wait, I forgot the word. the application rate, spray volume, those factors, they are related to the application method. So if there isn't the application method I'm using, then your country has to measure that. To do some field trials and measure. I think it's exactly what you guys have done to build this COP risk model you have. But just for backpack sprayer. See, there's a lot to be done. This is the problem. We in Brazil, we also have some data that from our country, but it's so few that we use EFSA, and when we don't have the application method in EFSA, we use EPA. We use EPA for aircraft delivery application method, and we use for seed treatment also.
Okay. So you mean that we could not use the EPA exposure data if our equipment or method in China is not exactly the same with EPA model, right?
I mean, it's more generic. It's not the same. They don't have. It's just like backpack sprayer, any kind. So, but you have to know the application rate and the spray volume. Okay, you have that, but it's backpack. And the EFSA has the...
Please.
What?
In China, we always have the back spray machine equipment. I mean, we have not so many kind of equipment such as EPA. Sometimes if we want to
tractors, you don't use tractors, for instance. You know? Tractor? Do you know what a tractor?
Sorry.
Yes, tractors. Just like God, I forgot the word also. It's a car they use in agriculture too.
I got it. Also, in China, it's not so common equipment. It's not very common equipment.
Okay.
But I know what you mean already. So your answer is quite detailed and very clear. So is there any new questions from our audience? No questions? Okay. Okay. Let's finish this part. Then, okay, thanks, Fatima, to give us a very silent speech and quite detailed information about risk assessment. Thanks for all the audience. Thanks for your participation. And today we start quite early in Beijing time, and it's already middle night in Brazil. Thanks Fatima. It's already quite late. And we also thanks Alexander for his support and good organizations. If you have any questions about today's webinar, just send a mail to me or get me in WeChat to tell me. Here is my
contact. And if Mrs. Thinking can email those questions to me, and I'm happy to answer them.
Yes, Fatima is always or third parties collaborations to deal with all the risk assessment issues.
If what? I didn't understand. I beg your pardon.
Yes, you can contact me first, and then I just forward your questions to Fatima. And you can save my contact for future communication. Thanks, Fatima.
Thank you very much. It was a pleasure. Nice to meeting you all. And thank you for listening to me. I hope I've been clear in this presentation. Thank you.
Thank you. Thanks, Fatima.
Bye-bye.
Thanks, everybody. Okay. Bye-bye. Bye-bye. We finished.